thanks for tuning in. My name's Dr. Abby Davids. I'm the HIV and Viral Hepatitis Fellowship Director here at FMRI, and we are here today to talk to you about our fellowship program. The program is a one-year post-residency fellowship that is offered to anybody interested in learning more about HIV, viral hepatitis, and several of the other specialty experiences that we offer. Those include viral hepatitis clinic, tuberculosis clinic, refugee clinic, trans clinic, and a PrEP clinic. And so it's a robust training experience that we have here. So what we wanted to do is give an overview of what it might be like to be a fellow here, and what the days are like. And so Marvin, maybe I'll ask you, disclaimer, both Dr. Alviso and I were fellows here at one point in our lives. And so what it's like to be a fellow here, what the kind of week looks like.
So as a fellow, you will be with specific providers like each day of the week, and three of them are primary care providers, and one of them is infectious disease specialist. So when I was a fellow, I always have these breadth of information, both from a very robust like infectious disease model and one who's been to, Dr. Roscoe who's been to Africa and has been treating like HIV AIDS and from a different perspective. So you always have this fresh and very groundbreaking treatment plans, like, because we always want to make sure that we're at the forefront of treating HIV and AIDS. So it was a great experience for me, and I'd like to pass it on for the fellow who's coming here as well.
Yeah. So what we try to do is provide an experience that's mostly outpatient-based, but does have inpatient components as well. And so a fellow will be in clinic, primarily in our HIV clinic, which here at FMRI we call that the Wellness Center, if you hear that term. And that's about 5 or 6 half days a week. And then there's a half day of either viral hepatitis clinic or TB clinic every week. And then depending on a fellow's interests, we can add in things like the trans clinic or the PrEP clinic. And then there's a little bit of family medicine, regular primary care in there as well. And then we consult on all of our patients in the hospital when they get admitted. And so that's been a really nice way for us to provide continuity for our patients. And we even do OB care for pregnant women with HIV. So it's a really broad spectrum experience. And I wonder if you both want to talk about what it's like from your perspective to work with one of our fellows.
It's been pretty amazing to watch them grow and start out with a little bit of knowledge, and by the end of their fellowship, they're well-versed.
And it's just great building that relationship with the provider and the entire staff. Just knowing, being there and helping them how to build those relationships with the patients that we already know. So I think at some point we're the bridge between the new provider and the staff here, because they feel really comfortable when we are just introducing who we are and what we are doing, and how they are just getting used to it, to the way that we are working with the patients.
So one of the things for the highlights of ending the epidemic of HIV and AIDS is through PrEP. So PrEP is a clinic that I staff. It's pre-exposure prophylaxis clinic. So it's a clinic to prevent this high-risk population of getting HIV. So in addition to treating HIV patients to make them undetectable, we also want to treat those patients who are high risk of acquiring HIV. So both of them work hand in hand in our goal to ending the epidemic for HIV and AIDS. And the fellow can also help, or if he has interest in another LGBT focus, I staff 2 of the specialty clinics here at the Wellness Center, one of which is called the Transgender Clinic. It's an available clinic for medical students, for residents. That's why it's a dedicated Tuesday afternoon, so they can rotate there, get some patients, and know more about these very specific populations that are needing healthcare here in Idaho.
Another thing just to explain a little bit more about is the viral hepatitis component of our program. And that is an important part of training for anybody who's going to be doing HIV care. Certainly should be well versed in viral hepatitis care too. And so we have a pretty robust clinic here in the clinic where we take care of folks with hepatitis B and C. But we also do prison medicine that way. And so we have treated many hundreds of individuals individuals who are currently incarcerated for their hepatitis B or C. And so that's been a really cool part. We have some other different populations too that we serve, including a very robust immigrant and refugee population. Cordelia, do you want to talk about that a little bit?
Yeah, I'd like to. Given the nature of our clinic, Emerald Center, we take care of all types of patients from different background, different ethnic, cultural, and races. So the fellows, it's amazing to just watch them. They start out really slowly and then learning across the spectrum of care, how they learn to manage all these cares. A lot of them that are intertwined, about a majority of the infections that they deal with, they are co-infections, and then they walk through all the processes and make sure that patients get what they need, and they become versed in taking care of all these immigrant populations. And it's just so great to work with them. And personally, I enjoy working with them. I've learned a lot from them, those of them that I've really interacted with. I've only been here for about 3 years. I can say that I've enjoyed the processes of all these different disease relationship and how they're separated, how they come together. And FMRI is a very integral place for all of that to come together, and learning there is amazing.
So while Idaho itself is not the most diverse place, certainly our clinic has just an amazing breadth of patients coming from different backgrounds, and that's one of the things that we love the most about working here. Marcial, do you want to talk about that too, or kind of our patient makeup?
Yeah, totally. Being a Latino in Idaho and just being in this environment makes me feel welcoming, and I think it's the same for the patients. All the patients, most of the Hispanic community, they feel really identified with a specific person to talk with. And I think it's the same for different races. They have like a key person to talk with. And you can see that when they feel special and they are just trying to get the resource or connecting with whatever they need. So it's just a great place to connect. And it's as you can see, we are diverse and we have a bunch of different populations here at the clinic, and that makes you feel really welcoming to the staff.
Just to see how when they come into the clinic at first, they're not very comfortable or trusting. And then once they've been here for a few visits, we're their solid rock. I think that's pretty interesting. They finally trust us. Earning that trust from them is important.
Yeah, it's one of the things we work really hard on throughout all our populations. Most of our patients come from the Congo, and so the top languages spoken in our clinic right now are Swahili, Kinyarwanda, and Kirundi. We also have a lot of Spanish speakers and some patients who originally came from the Middle East or Southeast Asia. So it's a really rich environment for people to come to, and I think the message that we want to portray is that it's a very welcoming environment. So what you would get out of a fellowship here would be obviously a great variety of clinical experience anchored in the HIV clinic with extra experience in PrEP, trans, hepatitis, TB, refugee care, and broad spectrum primary care. That's our main focus. If you're looking for training that is specialty focused but anchored in a broad spectrum place, in a place like Boise that has incredible resources and an incredible patient population, I think that's what we can offer with our HIV and viral hepatitis fellowship.